everyone, I am Alex. Today, I'm here to share what my group and I have learned through our research in the use of medicinal cannabis. In this speech, I will be talking about why our group chose to cover this topic. I will then talk about the pros and why it interested me. Then, I will move on to two important points that I learned from researching and completing this task. Before this speech, our group was required to research and make an infographic based on the subject of medicinal cannabis. Our group chose this topic because we all agreed that cannabis has become an increasingly popular subject, both in medical research and public debate, particularly as more countries begin to legalize its medicinal use. I especially wanted to dive deeper into the regulatory aspects and how it is used to treat patients, in particular, the benefits. Within our broader topic of cannabis-based therapies, from the research that I conducted, my main focus was on Sativex. Sativex is a drug developed from cannabis. What drew me to this was how it represents a balance between the medical potential of cannabis and the rigorous safety standards required for pharmaceutical products. I also wanted to explore how a plant commonly associated with recreational or illicit use has been transformed into a legitimate and effective medicine that helps improve patients' quality of life, particularly those with serious medical conditions. One of the most important things I learned is how drugs like Sativex are approved for use in countries such as Australia by the Therapeutic Goods Administration, or the TGA for short. This approval process is critical because it ensures the safety and reliability of the product and can entice customers to purchase it for their benefit as it is proven to have been safe, especially compared to unregulated herbal cannabis. For example, Sativex is manufactured under strict quality controls, ensuring that each dose is consistent in terms of potency and safety. This, however, in contrast to herbal cannabis, when used illegally, contains harmful contaminants like bacteria, in particular E. coli, which is often considered the most common bacteria found in illegally obtained cannabis. If you are wondering what E. coli is, it's a type of bacteria that can cause severe gastro in your body. This can possess a serious health risk, especially to vulnerable patients with compromised immune systems or chronic conditions. The second key takeaway from my research was how it is used to treat, as well as the effectiveness of Sativex in treating spasticity caused by multiple sclerosis. Spasticity is a condition that causes abnormal muscle stiffness, which severely affects movement and quality of life. Sativex is available as an oral or nasal spray and has been approved in over 24 countries, with Australia being one of them, to help manage this condition. What's particularly interesting is that it's not just the cannabis component that matters, but how it's processed and delivered. For instance, while recreational cannabis can often be used without guidance or supervision, Sativex is prescribed by a doctor and is used under medical supervision, ensuring its safety and effectiveness. This careful regulation means that patients can rely on it as a treatment option. A study in Canada has backed this up, as people who took Sativex noticed a decline in symptoms and pain just after a month compared to taking other drugs. You can see this in the graph on the bottom right. In conclusion, from researching this topic, some of the key information gained has given me a much better understanding than what I originally had. I now know that Sativex can offer significant medical benefits when developed and prescribed correctly, as well as reinforcing the importance of regulatory controls to ensure patient safety, especially in contrast to the unregulated use of cannabis. The message I would like you to take away today is that while cannabis may send out mixed messages, its medical potential, when properly regulated, can improve lives. Sativex is one example of proof that cannabis-based treatments, developed through heaps of safety protocols and guidelines that are rigorous, have the potential to offer real solutions for patients in need of any medical support, such as multiple sclerosis. These are my reference lists. Thank you all for watching and have a good day.